Jane is the president of the Association of Reproductive and Clinical Scientists, ARCS. She previously worked at University Hospital Leicester NHS Trust in roles including consultant embryologist, and she was the person responsible to the Human Fertilization and Embryology Authority for the clinic. And at NHS, she has been the Deputy Chief Scientific Officer for England. And Jane was the first person in the UK to achieve a master's degree in assisted reproductive technology at the University of Nottingham back in 1992.
So I'm going to reflect on how the innovation of IVF has transformed not only families, but also the scientific workforce, standards and professional practice. I'm going to focus on the ripple effects of the innovation, the formation of our professional body, and how the legacy has shaped ARCS as an organisation, including the development of training, laboratory accreditation, quality systems, ethics and research. So Bob was a scientist, as we've heard, who persisted through technical, ethical and regulatory challenges. His work with colleagues culminated in the first IVF birth in 1978 and a Nobel Prize, as we've already heard. As a founder member of ACE, which was the predecessor to ARCS, I'm honoured to be able to give this address, as I've said, recognising the impact of Bob's legacy on so many of my colleagues and on reproductive science as a profession. Personally, I was fortunate enough to hear Bob speak a couple of times, and I was impressed by his enthusiasm and endless knowledge. And as Geraldine said, one of the things I clearly remember is how Bob insisted that scientists and the rest of the team should be treated equally with the medics. And I was also lucky enough to do one of the very first training courses at Bourne Hall. And for me, IVF has always been a miracle, the feeling of excitement of looking down the microscope and seeing the evidence of fertilization, those first signs of new life. And I'm sure I'm not alone in this, but to have observed this the very first time, as Bob and Barry did, must have been so amazing. So understanding early human development was a significant step to opening the door to not only providing control over reproduction, it led on to the development of other technologies, as we've heard, such as embryo and gamete freezing, genetic screening, and the development of stem cell research and genome editing. And it also obviously gave infertile patients the hope and chance to have a family. But IVF just wasn't a clinical milestone or a scientific breakthrough. It went on to produce a whole new profession. Laboratories needed scientific and clinical laboratory specialists. Training programs and education was required. Professional bodies stepped up to define competencies, pathways, and safeguards. Changing ethical considerations were taken into account, and legislation followed with the first HFE Act drafted in 1990. The demand for skilled professionals increased, and the need to ensure effective training, laboratory standards, and quality assurance was essential. So ARCS itself was created in 2020 following the merger of three scientific societies, ACE, BAS, ABA, into a unified professional body of reproductive and clinical scientists, and we have more than 800 members, championing the integration of science and clinical care, creating the model for today's fertility clinics. ARCS commemorates Bob's legacy annually by inviting renowned scientists to present a memorial lecture at the annual fertility meeting. So why do professional bodies actually matter? So professional bodies matter to ensure advocacy and representation, representing the interests of members and to advocate for policies that benefit the profession and society. They are able to bridge research and routine care, defining roles, protecting patients, establishing high standards, and ensuring that good science scales safely across clinics. Of course, as we've heard, Bob's journey was not without controversy. IVF raised profound ethical and societal questions, from embryo research to the nature of family. Bob himself was at the heart of these debates, always advocating for responsible science carried out with humanity and compassion. Much of today's regulatory and ethical landscape in reproductive medicine owes its shape to his early advocacy. Ethical practice is central. Consent, transparency, traceability, and safeguarding. Professional bodies also advocate for fairness in access and for meaningful patient partnerships. We have STEM ambassadors with the ability to share their science and enthusiasm with young people, outreach schemes, and patient and public engagement schemes. So ARCS emphasises the role of standards, objective competency assessment, EQA schemes, robust validation, and KPI-driven improvement to sustain safe IVF. Through the legislative practice designed by the HFEA, the professional body has elevated reproductive science from a research field into a clinical discipline, establishing laboratory standards for embryo handling, culture, and freezing with validation of equipment, media, consumables, and procedures, ensuring continuous improvement through audits and KPIs, championing the integration of science and clinical care, creating the model for today's fertility clinics. So from bench to leadership, IVF extended roles, fostered multidisciplinary teams. Data and quality functions have grown alongside core embryology and andrology. For reproductive scientists around the world, Bob Edwards' legacy is their profession. And IVF catalysed the creation of formal training schemes and career ladders via the STP programs, and professional bodies underpin registration, CPD, and maintenance of competencies to keep practice current. The STP program is highly competitive, receiving 5,500 to 7,500 applications each year across the different disciplines. ARCS has developed a CPD scheme for its members, and it is through the enforcement of CPD that the professional bodies give the public, the sector, and authorities the confidence that individual professions will be striving to maintain and continuously improving skills, knowledge, and expertise to offer the highest quality and exemplary professional services. Of course, as Geraldine said, we should not forget research and innovation. IVF clinics are innovation hubs. Professional bodies should ensure that new methods are evaluated rigorously with standards that enable registries and benchmarking. Professional guidance should separate hype from evidence. And of course, beyond professional bodies, IVF is a global concern. Collaboration through congresses, EQA, and training schemes spreads best practice and builds capacity. So as I said, we have more than 800 registered ARCS members, and of the 109 HFEA registered clinics in the UK, the majority of these will have scientists supported by ARCS. ARCS has supported over 1,000 trainees across a variety of training schemes to achieve the ACE certificate, STP, HSST, master's courses and equivalents, and practitioner qualifications. ARCS also runs recognised EQA schemes and has issued multiple publications and guidelines, from laboratory guidelines and accreditation to one at a time, safe laboratory staffing to donor screening guidelines, and as a professional body, ARCS works closely with the HFEA. So in closing, we celebrate Robert Edwards not only as the Nobel Prize winner and a scientific pioneer, but as the founding father of modern reproductive medicine. His work has brought joy to millions of families and transformed what it means to offer hope in medicine. Every child born through IVF, every family made whole, is a living testament to his legacy. As a professional body, we honour his memory and we are committing ourselves to carrying forward his vision into the next century of discovery.